Hey, my name is Andy Rohr with Harmony Health Clinic. Thank you for being one of our patients. We hear very often confused and maybe different points of view or maybe some misinformation about diabetes. Well, I want to make a quick video about what diabetes is. You hear this all the time, and lots of family members have diabetes, and so we're going to jump right into maybe what it is and maybe some better understanding of what happens. Now, this doesn't have to be a complicated conversation, and trust me, just follow me for just a few minutes here. The gasoline of life is this magical molecule called ATP. Now, ATP stands for adenosine triphosphate. Now, you're probably already losing me, but don't. Stick with me. It turns out when the body makes ATP, it makes energy. It's nothing more than cellular gasoline. It's this cellular gasoline called ATP that allows our bodies to function. Every time your muscles move, every time you breathe, even when your brain works and thinks, it's using ATP. But where does this ATP come from? Well, it comes from our bodies, and our bodies make it. And it turns out that glucose is one of the ingredients that it uses to make this magical ingredient called ATP. You know those sweet gum balls that fall in the yard, those little spiky balls that fall in the yard? Think of those as glucose. And glucose is a giant molecule. Now, in comparison, a blood cell is about the size of an M&M. Put them side by side, notice the difference. It's this glucose that somehow enters the cells and powers it to make ATP. So let me ask you this, how do you think these sweet gum balls end up inside the cells? The answer is insulin. Insulin comes along, grabs that sweet gum ball and packs it down really, really tight. And as it packs it down really, really tight, other chemical processes in our bodies pull it into the cell, and the rest is history after that. Now here's the problem. Suppose you have diabetes. Insulin's going to come along and is going to try to grab this spiky sweet gum ball, but it can't. And that's actually what diabetes is. And so the end result is these sweet gum balls end up just circulating in the blood, destroying everything that it touches. So what's the end result? Well, I suppose if you could envision sand being poured into the crankcase of an engine, you could probably imagine the engine being destroyed by that. The same thing happens to our bodies. You see, these sweet gum balls that circulate in our blood because of diabetes scratch the blood vessel walls, and it makes the blood vessel walls highly inflamed. So the blood vessel walls send a message to the brain, and it says, hey brain, I'm really, really angry. So the brain sends a message to the liver and says, hey liver, can you help us out? And that's what the liver does. The liver sends a whole bunch of cholesterol to the blood vessel walls, plaquing those walls up with nice little painted on cholesterol. The end result is those blood vessels that were this big when you were younger are now this big. So I want you to envision this for just a minute. Suppose you have a blood vessel that's this big and a blood vessel that's this big. Which one of those do you think is going to have the higher pressure? It's the one that's the smallest. So that's where high blood pressure comes from. So now I've got this diabetes. Now I've got high blood pressure. And all this is happening from diabetes. But I wish the damage stopped there, but it doesn't. It continues. You see, these sweet gum balls, they destroy even the nerves in the legs. This is where peripheral neuropathy comes from. These sweet gum balls, they destroy the tiny little blood vessels in the eyes and the tiny blood vessels in our kidneys. That's where kidney failure comes from. That's why diabetics can't see very well. It's all from diabetes. And then my heart is pumping against all this high pressure because you see now those blood vessels that used to be this big are now this big because of diabetes. And so now my heart's starting to fail. And as my heart fails and my kidneys fail, my kidneys aren't getting rid of fluid effectively, and my heart's not pumping effectively, which makes the heart fail, which makes the kidneys fail, which makes the heart fail, which makes the kidneys fail. All of this is happening because of diabetes. And then somebody undoubtedly decides to go check their mail barefooted, and they step on a piece of trash. But you see, they don't know that they stepped on a piece of trash because they can't feel their feet because all their nerves are destroyed from these sweet gum balls. And that's when they show up at Harmony. They show up at Harmony with a diabetic foot ulcer, and there we go to work to try to salvage their foot. In a nutshell, I just explained to you about 4 years worth of pathophysiology, but that's diabetes for you. I just explained the pathophysiology of diabetes to you. It's something that takes many people in medicine many years to figure out. But if you'll just remember those glucose, sweet gum balls, as they build up in our blood, them destroying everything they touch. That's what diabetes is. And I hope that you can take this video, and I hope it improves your health. Thank you.